Hey everyone, and welcome back to the channel. Did you know that nearly 50% of providers nationwide noticed an increase in claim denial rates in 2023? A few of the top reasons for claim denials include errors in patient registration and other missing or incorrect documentation. But being able to understand the difference between the forms used in medical billing can be challenging as there are so many different kinds. However, as it stands, prevention is the best medicine. Working diligently to avoid claim denials in the first place will save you money in the long run. So it only makes sense to avoid any problems by educating you and your staff on the proper way to submit these forms. Today we are going to focus on the CMS 1500 form. So what is the CMS 1500 form? This form is a standard paper claim maintained by the National Uniform Claim Committee, or the NUCC. For reference, the NUCC is an industry organization that is in participation with the Centers for Medicare and Medicaid Services. Non-institutional providers commonly use this form to bill Medicare for patient services. Individual healthcare services may include therapists, physicians, midwives, dentists, and nurse practitioners. You may be thinking, doesn't the Administrative Simplification Compliance Act require that providers send Medicare claims electronically? And you'd be correct. This is unless certain expectations arise, which brings us to the CMS 1500 form. Expectations in which providers can use this paper form include situations in which a provider can demonstrate that the HIPAA claim standard does not allow submission of a certain kind of claim electronically, disability of all members of a provider's staff does not permit the use of computers and therefore does not permit the use of electronic claims, and other rare and unanticipated situations that are outside of a provider's control. When CMS cannot enforce this requirement out of good conscience, it would be against equity. The term providers in this case refers to physicians, suppliers, and other healthcare professionals. When sending a claim via paper form, these providers must use the CMS 1500 form. This form goes by sections which house specific instructions for completion. These sections include patient and insured information, physician or supplier information, diagnosis codes, procedure codes, and charges. The CMS 1500 form is a critical tool when it comes to correctly submitting healthcare claims efficiently. While filling out any medical billing form, your team should always adhere to the following key principles: accuracy and thoroughness, timeliness, compliance, and leveraging healthcare billing software. By doing this, you can rest assured your billing process is better streamlined and errors can be avoided. Staying informed on changing regulations and consulting with a clearinghouse on your submitted claims will strengthen your financial health in the long run. If you'd like to learn more about the CMS 1500 form, reach out to eTactics. And you've already made it this far into the video, so you might as well like it, share it, and comment below.